I'm Dr. Vasudha. I'm a pediatric ophthalmologist, and I would like to tell you some things about vision screening in children. First of all, why is vision screening important in children? See, there are about 3 lakh blind children in our country. If you see, there are about 8 blind children per 10,000 population. That may look very small to you, mainly if you compare it with adult blindness. But in childhood blindness, or for that matter in any blindness, there is something called blind person years. And what is that? That is the number of years that a blind person lives with blindness. And that, if you see, is really huge when you think of children getting blind. Say a 6-year-old child would be blind for another 60 years, whereas a 60-year-old person would be blind for another 10 years. So the blind person years is a huge thing, and that actually causes a lot of problem. Then the other thing is that the blindness in children, it is associated with under 5 mortality. What is this under 5 mortality? That is the number of children per 1,000 births, live births, alive to see their 5th birthday. That is the under 5 mortality. The problems that cause blindness also cause under 5 mortality, like measles, meningitis, vitamin A deficiency. These are the same. So until and unless you diagnose these problems and treat them, there are more children dying. So you could say that a blind child actually dies much earlier than a sighted child. Then the role of vision in early development. So see, without vision, none of the development can take place properly. The motor development, cognitive development, for that matter, even speech. There is a speech delay in children who cannot see well. 80% of the child's early development is dependent on vision. So a blind child will have delayed milestones. And later on, for academic readiness, in school, to read, write, psychosocial development, all these are dependent on vision. So vision is a very, very important sense. One other thing is that there is something called amblyopia or lazy eye. So what is this lazy eye? Lazy eye is when the eye and brain connections don't happen properly. So this, you could say, lazy eye can be treated at any time, but no, lazy eye cannot be treated at a later date. Suppose a child is having vision problems at 5 years of age, and you bring the child for treatment at 15 years of age, we've lost 10 years. The vision that could have been got at 5 years cannot be got at 15 years. So there is a kind of sense of emergency in treating childhood eye diseases because of this amblyopia or lazy eye. So don't delay. If your child complains that he or she cannot see today, bring her to the doctor, to the ophthalmologist immediately. Please do not delay, because amblyopia is sitting there like a demon and it cannot be treated later on at an older age. And when do you think your child needs an eye examination? See, when a child is born, at that time itself the pediatrician is supposed to do an eye examination, and it is done before the baby is discharged from the hospital. Then at 6 months, 1 year, then 3 years, 5 years, and then every 2 years after that a child requires an eye examination. This is irrespective of whether the child has any problems or not. You need to get a routine evaluation done, because sometimes the child will not have any complaints. say there is less vision in one eye only. You'll never know that because the child is sitting with both eyes open and using one eye all the time. And you will never know that until you test it. Sometimes children won't complain. They try to manage with whatever resources they have. If they cannot see for distance, they will copy from their friend, or they will go near the board, see what is written there and come back and write on their books. So whether the child has any problem or not, you should take your child for an examination at these particular times. And then there are some children who have complaints, like they complain of decreased vision, or sometimes they have an abnormal head posture. If your child is sitting in front of the TV and doing this, making a turn of the face to look at the TV, then also he may be having some refractive error. Some glass may be required to correct that. And some children hold books very close and see, and they prefer to go sit very close to the backboard, or they squint their eyes like this, they make a slit and then they see. That also means they have some refractive error. Some complain of headaches, then there are watering of eyes or red eyes, and any abnormality, if you detect something that something is wrong, then you need to take your child to the eye doctor immediately. Thank you.